When we talk about child's health, we often think about nutrition, infection, vaccination, or schooling. But there is another aspect of childhood that can shape child's life for years, and that is ability to walk, to move, and use their limbs normally. In pediatric orthopedics, early detection can make a huge difference. Some deformities, when recognized on time, treated early, can be corrected or prevented from becoming severe. But in rural areas, children may reach specialist care much later. What happens in that gap? To discuss these questions, we have Dr. Chasanal Rathod, a well-known pediatric surgeon from Mumbai. She has done her MBBS and MD from Mahatma Gandhi Institute of Medical Sciences in Sevagram, an institution which has a long tradition of linking medicine and community and people's life. Dr. Rathod, warm welcome to our Search official YouTube channel. And let me begin with your journey. You have a long association with Search and as well as Gadchiroli. How has it helped you shape as a doctor?
Yeah, so thank you, Shomita. So, yes, so my first association with Search was way back in 2000, not even 2000, it's 1996, when my father was superintendent of police at Gadchiroli, and first time I visited Search to meet Rani auntie and of course Abhay uncle, and I was very small then. That's how I used to call them auntie uncle, and that time I was not sure that I'll be a doctor, but I was really so inspired by the place itself and the lives they were living. And post that I came to we did so like you said, from during my medicine at Sevagram, so Dr. Anand Bang was my batchmate at Sevagram, and as a part of community medicine project, our entire batch had a trip to Search. And that was a very different experience because it was a bunch of medical students, around 55 of us, who visited Search. And so we saw the history of Search and how it all started with how the place we see today, how it was dreamt by Bang uncle and auntie. And of course, the vision they had then is now we all appreciate, but how it started it's like remarkable. So I think that holds a great impact on me. And today when I visit Search here, as from being just a visitor, a small young teenager with my parents, to a community medicine medical student visiting Search, and now after almost 23 years coming as a service provider, as someone who has come to treat children from the tribal area. It's a very heartwarming and a very touching thing for me. So I think it's been an emotional journey. I think it's a long journey, and I've just compiled it in 3 stages here.
But how did you choose pediatric orthopedic? Okay. What drew you to children?
Yeah, so when I was doing my internship at MGIMS Sevagram, so we go through a rotation of different subjects, and it was surgery, ortho, medicine. And I was really very much fascinated by the surgeries which orthopedicians did. And as an intern, we were just supposed to hold x-rays while the lecturer showed how the bone was reconstructed, or how the fractures were treated, or how immediately the patient was mobilized next day. So there's a hip fracture, you operate, they start walking next day. A spine patient, you do surgery, they start walking next day. So it was something where there was quick recovery, quick mobility, wonderful reconstruction. So as a female, taking up ortho was like raising many eyebrows then. And I think I have lived up to it and made up to it. In my second year during the Masters of Orthopedics, I decided to pick up pediatric ortho as my super specialty branch. And I thought the kids were really quite nice to treat them, and it was kind of neglected then. And there were very few people who were doing pediatric orthopedics as such, and that too in big cities, only tier 1 cities or the metro cities. So I think that was the thing I was inclined towards.
What is the pediatric orthopedic burden in India like?
Okay. So pediatric orthopedic, we could say that the burden may not be as such a burden, because a lot of problems now with the modern science get detected while the mother is pregnant. And some deformities can be treated very early in the infancy while the baby is small, less than 1 year, and we can give them near normal corrections. Apart from that, the other problems which come with the being physically challenged or disabled or differently abled, yes, that burden is little higher. It could be around 1 in 10,000 kids suffering with different neuromuscular problems which look like polio, but they are not like polio. So, which we would call cerebral palsy or some other problems. So the burden is little higher, and the treating doctors are way less. So if you look at the number of pediatric orthopedicians, the tier 2 cities like Nagpur just has 2 of them. And apart from that, Mumbai is such a big city, we could be hardly less than a dozen of them, of us in Mumbai. So yes, the burden to treat is lot. There could be a lot who go neglected. There could be some who don't want to come to the hospital, and so that's kind of a different story. So I have seen in certain camps where we visit regularly, there are children who are living with those deformities, and they have become so accustomed to the benefits which come with living with those deformities that at times they don't want it to be corrected. And yes, there is a certain different strata of society where they would want the child to be nice, corrected, and running around or playing with other children, going to school. And yes, I think those are the ones whom we have been treating here currently. So there is a burden, and there is a kind of disparity in the service providers as well.
So what do you suggest? How can this disparity, this gap be reduced?
So there are certain government projects which are running, which help us to identify children with deformities at school level. So RBSK is one of the schemes where they identify, the school teachers take up this. And before that, we used to have another scheme, that was the Sarva Shiksha Abhiyan. And they would pick up kids at root levels, like totally deep interior villages, and they would be brought to a place where a district level hospital where pediatric orthos can voluntarily go and help these children. And it was funded by the government. So I think we are already trying to build the younger generation of our nation, which is by treating their deformities. And a lot of other projects are there, so which help not only in screening and treating, but they also help in financial assistance to children in terms of certain insurance schemes. And in more than that, like schemes under employment are also being in place. It's just that it needs to reach the beneficiaries.
Staying on the same question, which are the deformities you think should be detected early and treated?
Yeah, so I think all the deformities have to be treated early. So we would consider kids like growing trees. And like we kind of, if the tree is bending, we kind of put a support to the tree. Same way orthopedic surgeries are like, they will shape the child while they are growing. And they would see to it that the child grows straight during their growing years in the right alignment. And I think all have to be addressed very early. And we shouldn't wait for them to grow up and grow into adults, because then as they grow, the extent of surgery becomes from a simple surgery to a supra major surgery. Apart from surgery, the child who's facing the pain and the trouble of going through surgery also gets manifold higher in that case. So I think it should be caught early, treated early. And
During your medical camps, what is your observation like? Why do children reach care late? Is it just lack of awareness, or is what really stands between the child and the care they need?
Okay. So I was looking into this awareness part, and we did a small little study, but I should say that even people in rural areas are quite aware. The problem is logistics, because traveling to a city to get treated and the compliance after treatment in terms of bracing, splints and orthosis is kind of limited. So now when we are operating certain cases here, our concern is that how do we give them a follow-up treatment in terms of orthotics? Because a lot of cases which we have seen had already gone to a city nearby, got treated, and they have gone into relapse or recurrence. So the problem is the travel, missing the wage, going all the way, whole day of traveling. Some procedures, some conditions like club feet need weekly plasters. So imagine somebody who's a daily laborer traveling every week to Nagpur, or maybe even Gadchiroli district hospital for that matter, misses that whole day wage. So the logistics part is, I think, more concerning. And awareness is really good. I mean, people are now very much aware that treatment is available. And with all the social media, WhatsApp and different apps, people are quite aware. There's no dearth of information anywhere in terms of awareness. It's just reaching there and following up and maintaining it while their child is growing.
So have families of these patients taught you something which you have not understood in your medical training?
I think in general, when you pick up this certain subjects and when you address a society or a bunch of people who are neglected or are not privileged to get that treatment, the first thought comes to us that we are so lucky. One is we are born perfectly fine. We don't have deformities, one. So the gratitude part, of course, that makes us much more better. And second is that everyone is so humble around that in spite of all this, they have tried to find a place, and the perseverance to get their child treated, I think, is some of the things we really need to learn from the families out here. And some qualities, they just come in as a doctor, like being empathetic, or I think we just, over the years, as we study, we kind of imbibe them into us. And being in MGIMS, it had totally shaped. Just like Search, MGIMS works on Gandhian ideology, right from doing prayers, wearing khadi, doing shramdan. It's such basic things which are taught in moral science in school, but as we grow, we fail to follow this in our lives when it is most needed. So when we are actually in a stressful situation, we forget the moral science which we had studied in school, which eventually, I think, when I was around for my MBBS and MS, I continued to do this, and it made a very much entirely a different person out of me being there. And I think it's still following and coming back to Search after so many years is itself the feeling that, yes, I still have those values within me, and everything felt so familiar around.
Dr. Rathod, you have worked in different healthcare systems in Mumbai, in Sevagram, you have been taught and brought up, and now in holding camps in rural areas like Gadchiroli. If we were to design pediatric orthopedic care around the needs of children, rather than just around the existing health system, what would it be like for you?
Yeah, so I think the designing a pediatric ortho camp needs quite a frequent visit. So I think consistency is one. Just doing one camp sporadically in a year is not the solution, because we need to grow with the child. So I think a very good team is one, and consistent healthcare. Like maybe here I look forward to train one of the junior doctors who will take up the regular follow-ups and look after the kids here. But yeah, good team and regular consistent follow-ups is the thing.
And one final question, like after spending time with these children and families, what is one thing you would want the health system to do differently?
I think we are doing good. We have addressed everything for children. The healthcare system is now, if you look at the current thing on 15th August, the government was actually giving vitamin A supplements to kids, which is so important for vision. So I think we are doing good in terms of healthcare systems currently. It's just that people need to avail them. They should not question that are the vaccines at a government setup as effective as normal when you go to a private hospital or a private clinic. Yes, they are equally good. The government has taken up that responsibility for the children. They don't want any problems in this. So I think as healthcare, it has been going very good, phenomenally good. Like I told you, the various schemes, the timely immunization, and reaching out people in areas which have inaccessible healthcare, it has been good. Yeah.
So perhaps the important lesson is that treating a deformity is not only about correcting bone or a joint, it is also about noticing a child early, understanding the family's circumstances, and making sure where a child is born does not decide whether they receive the care they need. Dr. Rathod, thank you so much for this conversation.
Yeah, thank you so much. Yeah.